Hi everyone, my name's Sangeeta Gopi from MedCity International Academy, Kannur. I'm here to present before you a 4-series video that we've planned on OET speaking. OET speaking il varumbo 4 situations aanu koodalayitte kuttiyal confusion parayunnathu. ഈ 4 സിറ്റുവേഷനിൽ ബേസ് ചെയ്തിട്ടാണ് നമ്മൾ വീഡിയോ സാമ്പിൾസ് ഉണ്ടാക്കാൻ ഉദ്ദേശിക്കുന്നത്. These 4 situations are: 1. How to deal with an irritated or an agitated patient. 2. To deal with a psychiatric patient. 3rd, ഒരു ചാലഞ്ചിങ് ആയി കാർഡ് വരുന്നതാണ് how to deal with a child patient. And the 4th in series will be one of the recent OET exam questions. അതിൽ വന്നത് ഒരു എക്സാം ഫിയർ ഉള്ള ഒരു പേഷ്യൻറ്റിനെ എങ്ങനെയാണ് ഒരു നഴ്സ് ഡീൽ ചെയ്യുക. So these are the 4 videos that we've planned to do. ഈ 4 സിറ്റുവേഷൻസിൽ എങ്ങനെയാണ് ഒരു നഴ്സ് ബിഹേവ് ചെയ്യേണ്ടത്, എങ്ങനെയായിരിക്കും ഇൻ്റർലോക്യൂട്ടർ റെസ്പോണ്ട് ചെയ്യുന്നത്, എങ്ങനെ ആ സിറ്റുവേഷൻ ഡീൽ ചെയ്യാം, ആൻഡ് ഹൗ ക്യാൻ ദ നഴ്സ് ഹാവ് എ പ്രോപ്പർ കോൺവെർസേഷൻ ഫോർ 5 minutes. ഇതായിരിക്കും നമ്മുടെ ഈ 4 സീരീസിലെ വീഡിയോയിൽ നമ്മൾ നിങ്ങൾക്ക് വേണ്ടി പ്രസൻറ്റ് ചെയ്യുന്നത്. As a part of the first video of these 4 series, today we will see how to deal with an agitated or an irritated patient. Hope this video helps. ഇത് കണ്ടു കഴിഞ്ഞിട്ട് നിങ്ങൾക്ക് എന്തെങ്കിലും കൺഫ്യൂഷൻസോ ക്വയറീസോ ഉണ്ടെങ്കിൽ always send us a comment or you can always message us. And I guarantee that we'll respond to you. ഇത് കൂടാതെ ഈ 4 വീഡിയോ സീരീസ് ചെയ്ത് കഴിഞ്ഞിട്ടും നിങ്ങൾക്ക് എന്തെങ്കിലും കൺഫ്യൂഷൻസ് ഉണ്ടെങ്കിൽ നമ്മൾ അറിയിക്കുകയാണെങ്കിൽ we'll think of having more videos to help you out. So all the best OET aspirants, and hope this video helps all of you who are planning to take the OET. Hi. In the first of the series, we will see how you can deal with an agitated or an irritated patient. For that, with me is Madan Kumar. He's one of our students, and he will enact the role of the nurse manager. Madan, your setting is a private hospital,
okay,
of a very busy surgical ward. Now, there were 4 emergency operations last night. Due to a flu epidemic, the night shift was understaffed, so less experienced on-call nursing staff filled in. On your morning round, you check on Sonia Affleck, who had an emergency C-section appendectomy last night. She is upset and angry about the poor nursing care she has received. She wants to be discharged today. And your tasks are: 1. Ask about what happened to upset her. 2. Explain the ward's staffing situation last night. 3. Address her anger at nurses. 4. Discuss her present condition and usual hospital recovery time. And the last task: explain why it would not be in her interests to be discharged today, especially without consultation with her surgeon. So Madan, this is your card, and I will give you paper and pencil.
Okay.
You have 2 to 3 minutes to prepare on this task.
Okay.
You can start your preparation now.
Thank you.
So Madan is done with his preparation. He has already had his 2 to 3 minutes. Now we will go on to the role card. And as you all know, we have 5 minutes for the role play. So Madan, you have 5 minutes, and I'll stop you when your time's up.
Okay.
You can start now.
Okay. Good morning. My name is Madan Kumar.
Okay.
And I'm one of the nursing managers working in this hospital.
Oh, so you are the nursing manager.
Yes.
I've been waiting to meet you.
I know. Fine. What shall I call you first of all?
Never mind. I just want to let you know that I'm really upset about things that happened last night.
Okay.
So I'm not happy, and I just want to leave from the hospital. Is there a provision where I can get my discharge today?
Fine. Yes, there are provisions, but is that okay if I ask you some questions about that? What happened actually? What made you to be upset?
Are you trying to tell me that being a nurse manager, you're not aware of what happened last night?
Fine, really I'm aware of it, and I should start my statements with apologizing you for the last night inconvenience at what you faced.
Not once, nurse, not once. It was 2 times.
Okay.
And I know that it was not my mistake, and one of your nurses had the guts to scold me.
Okay. First of all, I really apologize on behalf of my staffs, and there were some conditions last night where we were really understaffed, and my experienced staffs were moved to one of the busiest wards because of flu endemic yesterday. So I know that this is not an excuse for reprimanding you.
Definitely, this cannot be an excuse.
Yes, I know that, but what I'm trying to tell you is only because we had an unexperienced and the newly qualified staffs in the ward, that was the reason where you had these problems last night.
You know, I was told by the doctor not to move after the surgery.
I know, yes, I know.
And I had to get out of the bed twice.
Yes, I know. And as I told you, I'm really sorry on behalf of my staffs, and also I'm really sorry because that was the temporary situation where we usually will not come across such situations where we have to move our own staffs to other wards.
Don't you train your nurses here? Don't they know how to behave with patients?
Yes, we do know, and as they are newly qualified, I think this inconvenience and the misbehaving was because of they are newly qualified, and I'm sorry, I know that you are upset about it, but still I know that my staffs were newly qualified as well as they are not much experienced in the patient care, and as our all experienced staffs were moved out to the other wards, we taken the newly qualified nurses to come in to work for us last night.
Fine. So what is your solution for this?
Yes. First of all, I'm really sorry again, and I'll discuss this issue with the staff's nurses, and also I will discuss this problem and the misbehaving which is not at all appreciated in any conveniences in the nurses meeting.
So how do you plan to deal with that nurse who misbehaved with me?
Fine, I'll take an explanation from her for sure, because this is one of the misbehaving. Any nurses should not do it. So I'll take an explanation from her, and I'll find out what was the reason for her, and also we'll do something to educate her, and we'll teach her how to behave properly with the patient. And again, I'm really sorry about that.
Thanks for informing me, but can I get my discharge? I think I'll be better off at home. I have my mother and husband there to look after me.
Okay, you have right to go and right to take your discharge letter for sure, but I should say this, I don't actually I don't wish, or I don't feel like you should get discharged because you had an emergency appendectomy just last night. So I wish you should stay for a few more days and take the opinion from the surgeon. I think that would be very helpful for your condition.
Yes, maybe, but I don't want to continue in a hospital where patients are not cared for.
Okay, sorry, really. Again, because this was a temporary situation which will not happen again, I assure you that, and also we will make sure that we are adequately staffed, and this concern was already raised with my higher authorities, and it will be taken care, and I assure you that it's not going to happen again. So I really request you to stay here for a few more days till you get your complete recovery, and that is very important for your condition, as I know about it.
But don't you think I'll be better off at home? Like if I need to take bed rest, like I said, I have my mother and my husband there.
Yes, I know that they care for you, and also I understand your situation in this regard, but we will be able to care you for sure, I assure you that. And also we will be, there are many chances where you might get infection and your wound need to be seen by the specialist nurses as well as by the surgeon. So I think you should stay here so that you will get a better treatment, and I assure you that you will not have any more inconvenience like this again.
I accept what you said regarding the healing of the wound,
okay,
but I'm not really sure about the kind of treatment I may get here.
Fine. Regarding treatment, if you need any more information.
Thank you, Madan. That's the end of your 5 minutes.
Thank you.